This is a podcast from the Environmental Change and Security Program at the Woodrow Wilson International Center for Scholars.
This is Gib Clark with the Woodrow Wilson Center's Environmental Change and Security Program. I am here at a Population Health and Environment Conference in the Philippines with Sabita Thapa and Dhan Rai discussing their PhD programs in Nepal's Terai Arc Landscape.
I'm Sabita Thapa from WWF Nepal. I work as Manager for Program Development.
I'm Dhan Rai, Senior Program Manager, working with the WWF Nepal.
So we want to hear a little bit about the project you're doing in the Terai.
So actually, the Terai is along the Indian border, the southern part of the country. It's a very flat land. That area is known as Terai. This Terai Arc Landscape falls almost half in Nepal and half in India.
Terai Arc Landscape program is actually a very important area for conservation. This landscape includes a part of Nepal and part of India, includes one of the very important ecoregions, Terai Duar Savanna, tall grasslands, and this has many flagship species which are endangered, like tiger, rhino, and elephant. And WWF Nepal has been prioritizing its program implementation in this particular landscape since 2001, and the government of Nepal has already approved a strategic plan to implement programs, and we are implementing programs with coordination among the partners, for example, DFID, SNV, and UNDP, and many of our government partners are actually implementing the programs in coordination with all of us.
So we are here at a conference on population health and environment and in sort of integrated methods of development. How does your program involve PHE, and why is PHE an appropriate approach given the situation in the Terai?
Yeah, Terai Arc Landscape has a very high population growth rate, as well as the fuel wood extraction is very high. People are very much dependent on the natural resources, and these are the factors actually we consider are very important for us to implement the PHE project, the population health and environment. People are very poor in this particular landscape. Almost 50% of the population is below the poverty line. And we are especially working through the PHE project, the Population Health Environment Project, to address the issue of forest conversion, forest encroachment, and fuel wood extraction, and to bring the healthy communities and healthy ecosystems for the whole of the conservation sector.
Under the population management, so we are promoting family planning. And to educate the communities, there are several volunteers. Actually, they are conducting several education sessions, meetings with the communities. And also, there are some community volunteers who are distributing contraceptives to those couples who want to manage their family size.
In the health area, we are implementing programs like providing clean energy, especially to address the indoor pollution from the use of fuel wood. And also, we are providing clean drinking water, the supply of water, and also the biogas is implemented in the health. So, and how all the population and health issue linked to the environment is, this project is being implemented in one of the critical corridor areas of the Terai Arc Landscape, and this has just recently been restored, and now this is a critical link between a national park in Nepal and a national park in India.
There has recently been some conflict and violence in this part of the country, and there are obviously big political changes occurring in Nepal. How does that affect your program, and how does your program affect what is happening?
Actually, we had over 10 years the armed conflict. Even at that time, actually, we didn't had big problem in terms of implementing the activities because we were working with the communities, so the community were very much supportive, and we didn't have any problem. Now, at this moment, the government seems a little bit weak and has not been focusing more on the conservation. So there are some new problems are coming, like the encroachments.
Yeah, we see conflict as both the opportunity and less of constraint for us during all these times. Opportunity in the sense that it actually gave us a way to work with the communities. Earlier, most of our programs was implemented primarily through the government and the local government. But after the conflict, when the government was less influential and also it could not implement more of the activities on the ground, we started partnering with the local NGOs, local community-based organizations, and implementing a program like PHE, which includes all aspects of their daily lives: population, health, environment. Means we are addressing the conflict, bringing the people closer towards each other to talk about their daily lives, not just about how they get access to clean water, but also about their daily problems. So that was an opportunity provided by this kind of project. And constraints sometimes was for implementing the project in the ground. The volunteers and some of the project staff could not move around because of the blockades and the strikes that was going on around during the conflict.
If you would like to learn more about population health and environment issues, visit us on the web at www.wilsoncenter.org/PHE or visit our blog, The New Security Beat, at newsecuritybeat.blogspot.com.